Sawasdee Krub, and good afternoon once again. Today is Wednesday, the 6th of January, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So I'll start first with the general situation and the number of cases as reported by the spokesperson in the Thai language edition just now. For today, we have new confirmed cases as 365, making the cumulative number of cases 9,331. Out of the 365 new confirmed cases for today, 250 are cases of local transmission, 99 are cases from active case finding, and 16 from cases found within the state quarantine. That's 365 for today. The number of new recoveries recorded for today is 21, making the cumulative total number of recoveries standing at 4,418. The fatalities, we are sad to report to you today that there is one new case of fatality, making the total number of fatalities in Thailand at 66. This new case of fatality is a Thai person who underwent blood transfusion and had respiratory failure and succumbed to COVID. So our sincere condolences to the family of the deceased. Just some observations from the briefing of the spokesperson. From the 20th of December, as he had displayed a map in Bangkok, regarding the districts in Bangkok. From the 20th of December until the 4th of January, the map has shown quite a widespread area of infection in terms of the districts of Bangkok. On the 20th, there was still a number of districts, not so much, and up until the 4th, it spread in various districts in Bangkok. In the case of Samut Sakhon, an observation there is that we are now assembling information in various aspects for Samut Sakhon in particular. For example, the number of factories within the Samut Sakhon area that employ around 500 to 1,000 workers at least. For those types of factories, which have a substantial number, which we continue to conduct active case finding. For these types of factories, there are around over 100 of these factories. At the same time, we will continue to conduct proactive case finding, active case finding in Samut Sakhon, particularly in the various markets, even the smaller markets in the province. We have a map of the location of those markets, as well as the flats and the apartment complexes within the province, which we have the location. So we'll conduct that on a daily basis. The spokesperson also displayed the active case finding missions that we have per day. So for example, per each day, the active case finding will target in sets of 50 persons, and up to 300 and up to 800 per mission. And for each day, there might be around 15 or 20 missions. So in a smaller location or factory, targeting 50 people being tested through active case finding. In larger factories and markets or areas, up to 800 or plus. So each day, there would be close to 1,000 people being undergoing the active case finding, particularly in Samut Sakhon. This as an example. Of course, the numbers have been increasing since the beginning of the new wave in Samut Sakhon, and we hope to address this through active case finding. One piece of information that is important for English language audiences in particular, foreign audiences in particular, is about the travel restrictions or no travel restrictions imposed against people traveling to Thailand from the United Kingdom. because there has been news floating around and speculation on possible restrictions that might be imposed on people traveling from the United Kingdom, both UK nationals or people from other nationalities or Thai nationals, due to the discovery of the new variant of COVID, the new strain. The Foreign Ministry reaffirms that no additional requirements or restrictions have been imposed against those traveling to Thailand from the UK, as we have maintained a strict screening as well as quarantine, compulsory quarantine for all inbound passengers in state quarantine for 14 days. And of course, the work at our embassy in London continues, and we have some images on screen there. So all foreign visitors are required to present the COVID-free certificate to stay in quarantine for 14 days. There had been the case of 4 British patients who had tested positive from the new strain, and they were detected while in quarantine in Thailand. So the meeting, CCSA meeting chaired on the 4th, that's Monday, resolved that, of course, public health would be the main criteria or basic. The situation of public health would be the main criteria in considering additional measures for those traveling from the UK. And while there is still insufficient information to prove the severity and the origins of the new strain at the moment. And another meeting also decided to allow the Foreign Ministry, through the Thai embassies and consulates in countries of high risk, to request for additional documents from inbound travelers, such as COVID-free certificate for Thai nationals in order to prevent infections on board as necessary. And of course, to be more rigid in the documentation of various travelers, especially those coming from the United Kingdom. So no travel ban, but of course more stringent measures in terms of documentation. And we advise Thai and foreign nationals who wish to enter Thailand to follow the further announcement by the Thai embassies around the world, especially on documentation, if there would be new or additional documentation required for entering Thailand, with the view of complying to the COVID screening procedure and not in any way intended as a travel restriction yet for those wishing to enter the kingdom. Another piece of information that I'd like to share is that there had been news reports in English from a news outlet in Myanmar that had featured coverage which might have caused some misunderstanding with regard to Thailand's treatment of migrant workers in the context of COVID. So to clarify just briefly is that, of course, under the leadership of the Prime Minister Prayut Chan-o-cha, the Thai government fully recognizes that COVID is a pandemic of global scale, of course. It knows no race, age, gender, nor nationality. So it's quite baseless to assume that anyone in the Thai government would be, of course, pointing fingers or blaming any specific person or nationality as the cause of the pandemic. Of course, in Thailand here, we fully realize that the disease recognizes no borders or nationalities, and Thais have always regarded migrant workers in Thailand from neighboring countries as an important part or a workforce that have helped move the Thai economy forward, especially in the industrial sector, in the construction sector, in the fishing sector. So therefore, it is our policy to treat migrant workers with dignity, of course, and to receive the same medical attention as Thai workers, as Thai nationals. And this is a principle that agencies in Thailand have always adhered to. Migrant workers from neighboring countries can be rest assured that all agencies will, of course, treat you in the same, with non-discrimination, and treat you in the same way that Thai workers are treated, including in terms of medical assistance. And with the view of facilitating the stay of migrant workers from 3 neighboring countries, Cambodia, Myanmar, and Laos, the cabinet has approved special measures to allow migrant workers to legally work in Thailand for a period of up to 2 years, provided that conditions and requirements are met. And we have mentioned this, the details of this already in the past. So the Prime Minister attaches great importance to providing the best medical care to all COVID-infected persons in Thailand, to the best of the ability of the Thai healthcare system, which is globally recognized. And this is carried out regardless of nationality, race. We attach high importance to all patients equally. For Samut Sakhon in particular, the Ministry of Public Health, as the main focal point, has been working in close concert with other agencies to find the best possible avenues for medical treatment, including quarantining, for separating those who are positive and those who are negative in terms of COVID, working with the Thai Red Cross in providing sustenance and supplies to all the workers, working with the embassy, the ambassador of Myanmar in Thailand, to conduct on-site visits and providing moral support. We've also been fortifying our surge capacity in dealing with positive patients, COVID-positive patients, finding more, building more field hospitals, as mentioned by the spokesperson just now, hospitals and hospitals in each province as per the directive of the government. And to affirm finally that the Thai government attaches utmost importance to all COVID patients, providing them with the best possible medical attention so that all of us can transcend from this global pandemic together while leaving no one behind in Thailand. Another issue is about the announcement by the Sheikhul Islam of Thailand. Yesterday, the Sheikhul Islam Office of Thailand announced measures to control the spread of COVID during Friday prayer or Jummah at mosques, and to strictly adhere to the guidelines of the Public Health Ministry as follows. The first is the mosques in the Muslim mosques in the level 1 or red areas, highly controlled areas, shall refrain from organizing Friday prayers altogether. Second is that the provincial Islamic committee will coordinate with the provincial authorities in various controlled zones. If there is no Islamic committee in that province, the imams of those mosques shall coordinate with local authorities to implement appropriate measures. The office also urges Muslims in Thailand to refrain from organizing activities that will lead to gathering, community service organized by mosques, societies, and groups on a daily, weekly, and monthly preaching, and religious lessons for children instead. The Sheikhul Islam of Thailand have asked the parents of those children taking lessons in the areas as well. So I'd like to share with you just information on today's act of kindness. Dr. Tuisin mentioned this as well, that in Samut Sakhon province, the chief executive of the sub-district administration organization of Samut Sakhon, may I mention the name, Mr. Wattana Tangmani, who is chief executive of the Pantai Narasing sub-district in Samut Sakhon, recently donated his personal land and money to build a new field hospital that is very much needed in Samut Sakhon that will have the capacity of 1,000 beds. Just to reiterate again that COVID as a pandemic of global scale does not need any discrimination. It's baseless to say, of course, that any specific nationality is at fault. We have always regarded everyone in Thailand as a part of our society, and we'll try to treat everyone in terms of the medical treatment to the best possible ability and capacity of the Thai medical system. And to end today's briefing, I'd like to share with you some pictures as coming up on screen. Still pictures of a video clip produced by SCG on their Facebook and YouTube channels for Myanmar speaking persons, our Myanmar brothers and sisters watching from home, on certain tips and tricks to stay safe during COVID-19. The clip is both in Thai and Myanmar language and performed by our village health volunteers and migrant health volunteers also in the Myanmar language. And the QR code of this link, this video, is shared to you on screen. If you have any Myanmar colleagues or friends, you can share that to them widely. So this is all I have for the briefing today. Thank you very much for your attention, and we'll see you again tomorrow. Thank you. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณ